typhus is the topic. And before I continue, very important not to confuse typhus with typhoid. These are two separate medical conditions, so make sure you don't make that mistake. So let's talk about typhus, and in particular, the two different types of typhus. We have endemic typhus and epidemic typhus. And what I'll do is I'll first talk about endemic typhus, and then I'll compare it to epidemic typhus, sort of like a table. So the first thing I wanted to mention is that endemic typhus can sometimes be referred to as marine typhus. It has a additional name, I guess. It's caused by rickettsia, in particular an organism named Rickettsia typhi. It is transmitted by rat fleas. This is very important on clinical vignettes. Sometimes it can also be transmitted by cat fleas, but this is a very important part of the vignette that will help you distinguish what is the correct answer. In terms of geographic areas, it can occur in many parts of the world, but on clinical vignettes in North America, you will oftentimes see the southern western part of the United States. For example, the state of New Mexico is often mentioned. Symptoms are unfortunately very generic symptoms. They're very difficult to distinguish this from anything else. That's why you have to rely on a lot of the other clues. But one thing I can definitely show you is the rash. It's a very specific type of rash, and I have a couple pictures. Here is a rash of typhus. As you can see, you have these maculopapular appearance, erythematous as well. And here's another patient that has these macules that are appearing pink or red. In terms of diagnosis, you actually can do a biopsy of the rash, and that can help you detect the rickettsia organism. And in terms of treatment, it is treated with an antibiotic, most commonly doxycycline. So now let's go back and compare endemic typhus to epidemic typhus. First, there is no other name, it's just epidemic typhus. The type of rickettsia involved in epidemic typhus is Rickettsia prowazekii. How is this transmitted? This is important. It's different. Body lice. A patient that has louse infestation will be described. Very rarely, it can also be transmitted from squirrels, but body lice is by far the most common. In terms of areas, the continent of South America is often mentioned. Notice, not the southern part of America, but the continent of South America. Symptoms are identical, same as endemic typhus, but in particular, the rash is also a helpful characteristic physical exam finding. Usually they're initially small pink macules, and then later they can progress to more darker maculopapular rash that is erythematous. Diagnosis involves the exact same tests, and the treatment is also the same. Doxycycline can be given 200 milligrams on the first day, and then you can continue 100 milligrams twice a day for 7 days. That should be sufficient to treat this condition. One thing I wanted to mention with epidemic typhus in terms of its prevention is louse control. Since those body lice are responsible, this can be a relatively easy way of preventing a person from developing a much more serious condition known as epidemic typhus. One final important point about epidemic typhus is a rare condition, but definitely worth mentioning since it appears on the licensing exams, is Brill-Zinsser disease. So, what is this? This is a recurrent form of epidemic typhus. This is something that can appear years after an initial infection. And it's sporadic in nature, and it happens because the organisms have retained in the body and are now activated again. So now let's take a look at a few clinical vignettes. 6 days after receiving several flea bites in a rat-infested shed in southeastern New Mexico, a homeless 24-year-old man develops fever, chills, and a rash that spreads from his abdomen to cover his extremities. He is seen at the hospital emergency department, where blood is drawn for analysis. 8 days later, the public health department reports the presence of antibody to one of the rickettsial group antigens. Which of the following is most likely? Diagnosis. Well, rickettsia makes me think of a lot of stuff, but the rat fleas helps to pinpoint Rickettsia typhi, and that causes endemic typhus, which would be choice A. A 30-year-old man comes to the physician because of fatigue, cough, headache, backache, joint pain, and chest pain for 6 days. 1 day ago, he had a sudden onset of fever and chills, and worsening headache, and a rash that began under his arms and spread to his trunk. He returned from a missionary trip to South America 2 weeks ago. He had no exposure to farm animals. His temperature is 38.8 Celsius. Exam shows an erythematous maculopapular rash over the trunk and extremities that spares the face, palms, and soles. There is diffuse muscle tenderness to palpation. Which of the following is the most likely diagnosis? He has all the classic symptoms. He has the rash, and he has the recent trip to South America. And although the clinical vignette is not extremely specific, it does give you enough clues to point to epidemic typhus, which would be choice B. 71-year-old East African immigrant woman was taken to an emergency facility in Boston. She was shivering, had a fever of 102.5 Fahrenheit, and pharyngitis. She complained about pain in her joints and muscles and a very severe headache. Exam showed her to have a papular rash on her legs and back. Physical and radiographic exam of her chest indicated an atypical pneumonia. Upon taking a history, she revealed that there had been a typhus epidemic in her village when she was 5 to 6 years old. Her parents and siblings were very sick, but she only had a slight cold. The patient was treated with doxycycline, and her symptom cleared up within 10 days. Which infectious agent is most likely responsible for these symptoms? This is a case of Brill-Zinsser disease. And if you recall, that is a condition where a patient can develop epidemic typhus years after the initial infection. And this occurs because the organisms have been retained in the body and now are activated again. So what infectious agent causes epidemic typhus? It's a rickettsia. And which one? Rickettsia prowazaki, which would be choice C.